Okay, so let's just a little round up here on your mother, and then we'll move on to your father. So your mother had a victory. They paid some of the money back. Have you received that money?
I received that money. It took another 3 or 4 months to get the money.
Did they pay interest on it?
They did pay interest on it.
Wow.
I also claimed for physiotherapy fees because physiotherapy for my mother is absolutely essential.
Sure, but a few fees. Massage.
Because her joints and her limbs are quite contracted.
Okay.
It took quite a long time. It took about another 6 or 7 months to actually get the physio fees back, but I got them. Okay,
so you've got the bit between your teeth now, Angela, haven't you? You've seen a glint of victory here. So let's talk about your father. What was his situation?
Well, he had actually been in the care home for 2 years before I kind of thought, actually, his needs are getting quite serious.
So he'd had Parkinson's.
He's had Parkinson's
for a long time.
Yeah.
Well, what other needs did he have?
He was developing Parkinson's dementia.
Is that a kind of dementia that's associated with?
Yeah, it's a different kind, but it's essentially dementia.
Okay, so did he know you and that sort of thing?
Yeah, he still knew me, but he needed more care than my mother because he had the more typical Parkinson's symptoms. He was very shaky, very unsteady, had a lot of very bad falls. He needed more care, more looking after. And because he needed more care, and the care home manager had told me he needed more care, I started to question, well, why isn't he being funded? You know, is he still paying for himself? And then I discovered that no assessments at all had been done on him.
Didn't you think to ask, when you were fighting for your mother, who I suppose had a more obvious clinical need than your father, to start with at least, when you were fighting for your, did it not occur to you that you should ask for an assessment for your father?
Actually, it didn't, because my father was better than my mother in that sense. I kind of left that, and I knew I could come back to it if I wanted to. But the case for my mother took so much energy, so much time. I needed to focus on that at the time.
Okay.
And then I moved on to my dad.
Okay. So tell us about that then.
So when I realised that he hadn't actually been assessed at all, I wrote to the NHS and said, you know, what's happening, what's going on, why isn't he being assessed? Could you send me any information on assessments that he has had, and he hadn't had any.
Is this the strategy then of the NHS? Because the longer they delay an assessment, well, there can be no decision about them paying while he's unassessed.
Yes, that's right.
So it's a deliberate policy.
But I suspect if they had assessed him, they would have found him ineligible. You know, it would have been a formality.
Because that was their policy, or because he was ineligible?
Because very few people win funding. And, you know, his needs at the time were very much like a lot of other people in care homes, and they're deemed as social needs.
So, I mean, it seems to me that, I mean, let's talk about your mother again for a second, that if you hadn't fought as hard as you did fight for your mother, she would still be
She'd still be paying, absolutely, yeah.
So if elderly people are in homes and they don't have a son or a daughter fighting for them, there's no one else that's going to volunteer.
They have no chance.
They don't have... No it's not, the care home doesn't appoint a sort of a champion for them or something, does it?
Care homes are supposed to flag up when somebody needs nursing care, and they're supposed to flag up when their condition changes. But very often that doesn't happen, and it's either because the care home just doesn't have time, or because the care home might be concerned that it won't get paid one way or the other.
Does it has to what, have a good relationship with the NHS, or?
Yeah, there is that need to have that relationship. Or it could be that the care home is simply not, the staff are not aware that they need to flag it up.
Or poor training.
Yeah, poor training, or just not aware that there is a link there. So if you're in a care home and you have no family, you're lost, really.
That's incredibly sad, isn't it?
Very sad, very sad. If you have no one to fight for you, no one else is going to do it, you know.
And obviously, if you have dementia, you simply can't do it for yourself.
And you wouldn't be aware of what's happening.
So they take your money and they run.
In a way.
Okay. So, your father?
Yes, so I asked for an assessment to be done. At that same time, the government introduced a new procedure for assessments. There had been so many complaints that the Ombudsman had kind of directed that a new procedure should be in place.
Yes, it was as a result of that case, Cochran, and another one called Grogan. Yes, that was, again, a very important case. Maureen Grogan was a lady that suffered from multiple sclerosis.
Okay.
She had skin edema problems and a whole host of other issues.
Skin edema, what is that? The blood clots?
Well, it's where the skin can break out into ulcers.
Oh, sorry.
And she was a very poorly lady again, as with Pamela Cochran. And yet again, it had to be fought through the NHS systems, and this one went up to the High Court. And again, the High Court said, yes, this is right. And it said to the Health Authority, this is wrong. You know, your interpretation of the guidelines here is wrong. But to be fair, the guidelines were all over the place. There needed to be some form of pulling together. And as a result, this national framework came into being. The Ombudsman had criticised it, judges had criticised it previously, and there was need for this national framework. So this national framework now says this is how we go about assessing people's needs. There's an initial assessment to establish whether there ought to be a further assessment. It's a sort of a weeding out process. And if a further assessment is necessary, then a nurse, a doctor or other healthcare employee who's qualified and able to do this is meant to take this forward with this medical specialist needs. At least 2 of them have to do this.
So the High Court's wrapped the knuckles of the NHS, but it hasn't had any effect, has it?
Well, it has had some effect. It's tidied up a lot of what was going on, I'm sure. But there is still the issue of interpretation of what these guidelines should be, and then a person's understanding of assessing this person against these needs. Where do I draw the line? And I believe that's where we have the fundamental problems, either because these people aren't trained well enough, they're too busy and therefore are making quick judgments, or there's a pressure on them to say, make sure you're going to go down the right side of the fence here.
I mean, I've got one NHS insider here who's texted before, Linda in Birmingham, and she says the whole system is the problem. This is why they were privatised and people could make money out of elderly people. The NHS will do anything to get out of paying, and well done for winning. So it's a bit kind of like granny farming, isn't it? These people open these centres and they have to find the I suppose, the low-hanging fruit with regard to being paid. If they can get the money off the patients.
If they get money for fees from somebody who's paying for themselves, they get more money.
Oh, they get more money? So they have to give a discount to the NHS. Well, no wonder the assessments all go in favour of the NHS, because...
So is
that actually the case? You know that as a fact?
If somebody's been funded by social services, I know this from when I had the emergency funding, social services paid the home less than we were paying.
Well, they get a sort of
before.
bulk buy discount, do they?
Yes,
yeah,
right.
I mean, they block booked the rooms, the beds. But I did notice that when we had to pay everything back and start paying again, after we'd been able to sell the house, the fees were higher than the ones social services.
But the money you paid back was the block booking rate, wasn't it?
Yes, I paid that back at the block booking rate.
Yes.
But then our subsequent fees that we were still paying for Dad were at the higher rate.
OK, well, we're getting ahead of ourselves again here, aren't we? So let's quickly talk about your father then. So you wrote to the NHS and you said he hasn't been assessed.
So they did an assessment, and as Simon was saying, it was the initial filtering out or filtering in.
Were you at this assessment?
I was at the assessment.
And were you able to bring up his medical records? And...
Yep, the same thing, same process as before. They hadn't considered all the things that were important. They hadn't spoken to his neurologist, they hadn't spoken to a GP, they hadn't spoken to the psychiatrist that he'd been seeing. All these physicians that you would think would be important had not been consulted and had not inputted into the assessment.
Okay. Excuse me for asking, why was he seeing a psychiatrist?
He was seeing a psychiatrist because his mental health was deteriorating.
Oh, and he was making an assessment of that, was he, the psychiatrist?
Yeah. So all these things need to come into the pot, but they weren't. So the filtering process took place, and then the NHS decided, rightly, in my view, he needed another proper assessment. It's a very long process. That then went to an internal PCT panel at the local primary care trust, and that came back to say, no, not eligible.